Hello, this is the second in our series of short videos demonstrating the key components of the care protocol used in the Gastroschisis Interventional Study in Ghana, Zambia, Malawi and Tanzania. This video is focused on the resuscitation of the neonate on arrival to the tertiary paediatric surgery centre. Many of you will have a gastroschisis protocol similar to this, which you can follow for guidance. So upon arrival, place the baby on the radiant heater or resuscitator. You can ask a colleague to kindly call the paediatric surgical team to alert them of the arrival of a baby with gastroschisis. Then we're going to follow an A, B, C, D, E approach to resuscitation. So A for airway. Is the airway patent? Is the baby crying? Do they need an intervention to help open the airway? B, breathing. Going to put on a saturation monitor, going to look at the breathing. I happen to notice that the bowel is not covered with plastic as we would like it, so as the saturation monitor is picking up, I'm going to very quickly slip on a plastic covering to prevent any further hypothermia and fluid loss during the resuscitation time. Still not picked up, so I'm just going to quickly dry the baby, discard this towel, get a dry towel and put a hat on. Okay, so the saturation's now picked up. In a term baby, I'd like to see the saturation above 94%. In a preterm baby, it can be between 88 to 92%. If it's lower than this, I'll apply oxygen to get it within that range. Then I'll move on to C for circulation. I want to check the heart rate of the baby. Should be between 110 and 160. If it's above 160, it may signify that the baby is either dehydrated or septic. I'm going to check the central capillary refill. So I'm going to press on the sternum for 5 seconds. 1, 2, 3, 4, 5. I'm going to release. Normally the colour would come back within 2 seconds. If it takes longer than that, it may signify that the baby has shock. I want to check that the baby has a functioning cannula. This baby thankfully already has a cannula from the district hospital. I am flushing it and this does thankfully work. If not, I would have placed a peripheral cannula. This can be very challenging if the baby is septic, dehydrated or hypothermic, in which case you can use the umbilical cord for umbilical vein catheterization. I'll also check the referral for the baby. How old is the baby? Have they been given any fluid in the local hospital? In most cases, the baby will require a 20 ml per kilogram fluid bolus. So if this baby is 2.5 kilograms, I'm going to give 50 ml of normal saline. At the same time, I can look up whether the baby has had antibiotics, and if they haven't, I'll give broad spectrum antibiotics as well, something like penicillin, metronidazole and gentamicin, or equivalent according to the local policy. At this stage I could also send off bloods, full blood count, Usanese and a blood culture. And I can set up some 10% dextrose maintenance fluids. A, B, C, D. Okay, I want to check the conscious level of the baby and also the blood glucose level. If the glucose level is low, I can also give a bolus of 10% dextrose. E for exposure. I'm going to check the temperature of the baby to know how much the baby needs to be warmed up under the radiant heater. I'm going to just have a quick look all around the baby to see if there's any other obvious pathologies. Okay, so I've done A, B, C, D, E. Now I can check the nasogastric tube. Is it in position? I want to aspirate on that. I'm going to aspirate as much as I can out. So I've managed to aspirate 50 mils. This is what an inflated stomach looks like in gastroschisis. You want to see that that balloon-shaped stomach has flattened with decompressing and aspirating on the nasogastric tube. Whatever volume of bile is aspirated, you want to then replace mil for mil with normal saline intravenously to prevent dehydration. And that nasogastric tube can remain on free drainage. Okay, at this point we're ready to apply the preformed silo, and we're going to speak to the surgical team regarding whether they can be here within an hour to do that, or whether the team on the neonatal unit or on the paediatric surgical ward are going to apply the silo.